Well, hello, Dr. Farah. I'm excited to have you join me today to talk about your personal health success story and what you have learned along the way.
Thank you so much for having me here today, Casey. And so looking forward to sharing my story because I think it's going to inspire those who listen.
Yeah, absolutely. I know it will. It's really a common, what you've experienced, I think is really very common for women, especially, once you get to be a certain age, everything it feels like starts to sort of fall apart. Yeah, so I think this will be super insightful for folks. So let's go back to the start of your health challenges. What were you experiencing and kind of when?
So going to the really very, very beginning, as a child growing up, I
Mhm.
was I had frequent sore throats and infections to the point that I would say, "Mommy, I have tonsillitis," and then she would just take me to our GP, and it was inevitable that they would be giving me a course of ampicillin and penicillin and what have
Mhm.
you. And soon I developed like belly pain and stomach ache and diarrhea as symptoms, which almost became a part of my growing up. And then fast forward, I went to medical school and we had a quarter of our internship where I was going to rural and underserved villages in India, serving the community there. And the water that we drank, the food that we ate may have, growing up in India, some parasites. So again, I would get tummy upsets, and we
Mm.
would just joke about it as medical students and take some anti-giardia and anti-parasitic medications. And then I moved, and for my higher studies, I went to England. I saw the whole healthcare system there. And that's where I met the love of my life. And I moved to the United States, and I was doing my residency in Houston. But in the last year, when I was pregnant, I ended up with an emergency C-section.
Mm.
That's when really my health fell apart. And of course, those were the scariest moments of my life, going
Mhm.
through an emergency C-section where
Mhm.
everything was literally crashing around me. My blood pressure, my heart rate, my oxygen, my
Ah,
baby's heart rate, and being
yeah.
just rushed into the OR. Even all these years of medical school and residency training had not
Mhm.
prepared me for that.
Mhm.
And
Mhm.
my baby ended up in the neonatal intensive care unit for days with IV antibiotics. Of course, I received IV antibiotics with my C-section and anesthesia. And soon I come home with this bundle of joy, only to find that my body had kind of shut down. I
Mm.
was so dead tired. I had to peel myself off the floor, couldn't even
Mhm.
take care of my own baby. And this
Wow.
was the most joyous moment of my life, but I found myself crying with postpartum blues. And I would
Mhm.
have these terrible headaches, terrible tummy upsets, and all this weight that I had gained over pregnancy that I thought I was going to magically lose. Actually, I
Mhm.
started gaining even more weight. I started blowing up.
Mm.
And I found weird things going on with my skin, and I had no sex drive, and really it just wasn't me, and I couldn't understand what was going on with the hair loss and rashes. And so I went to my OBGYN, and I was just told, oh, it's normal, it's part of being a new mom, it's part of being a
Right.
stressed out resident. And I
Yeah.
knew that wasn't the answer I was looking for. I knew something
Yeah.
was wrong, as most women do. We are in tune with our bodies. And it was much, much later that I discovered that I had Hashimoto's. I had, of course,
Mhm.
been diagnosed with IBS all my life. I had underlying infections and food sensitivities. And
Mhm.
so that's when I was able to hone in into the root causes of my problems and
Mhm.
get them resolved. These were the
Mhm.
main things, but along the
Mhm.
way, I've I had a car wreck and had traumatic brain injury and literally a bleed within my
Wow.
brain, but not enough to need surgery, luckily, but enough to really turn things around even then. And knowing now what I didn't know then, of course, I would have done some things very differently, but it was such a revelation to me as a practitioner, as an MD, as a doctor with all these years of allopathic medical training. It hadn't really equipped me to
Mhm.
help myself or to help those who I work with, my patients, my clients. And so it was such a big eye opener for me.
Right. Absolutely. Absolutely. So I'm curious, kind of, when you reach this point of realizing that conventional medicine kind of wasn't going to help you or help you to the extent that you needed, yeah, where did you go from there? Like, did you start doing your own research, or finding other practitioners, or and I guess there's two parts to that. What lab testing did you
Mhm.
find, and all that?
So in the beginning, really, I had no clue about functional medicine because that's not the way I was taught. And as a lot of people who go through the conventional training are really unaware about the power of nutrition and the gut and root cause medicine. And yes,
Mhm.
I did do a lot of research, but even that didn't give me all the answers. And yes, I did initially ask for labs and literally told my physicians, can you check for this? Can you do this? And
Mhm.
I was still told that my labs were normal. And this was
Mhm.
blood testing, but more extensive blood
Mhm.
testing. And it was actually when I went to a conference in functional medicine and just heard what was being taught, that was when it was like a light bulb went on. And I was like, where was I all my life? And that's when I learned about functional medicine truly, because I had heard about it, but really had no clue exactly what it was or how I could learn more about it. So
Mhm.
that was what led me to a different path where I knew there was no turning back from then. I could not practice the way I had been practicing. And
Mhm.
then I started on this journey of self-discovery for my health. And
Mhm.
then it was when I got mentors, educators, and the
Mhm.
testing, which then brought me to the answers, turned my health along in a really transformative way. And
Mhm.
that was when I made that key turning point in my career as well as what
Mhm.
I stood for.
Right, right. Yeah, it was transformational on so many levels for you, for your health and for your career.
Mhm.
So, um, yeah, so, in which makes complete sense. So, I get, so when you started looking deeper at your own health, what did you really uncover regarding the root causes?
So one thing that I was truly astounded by was that I thought that I ate healthy and exercised, but
Mhm.
what I discovered that there were certain foods that were clearly not for me. They
Mhm.
were clearly creating tremendous problems. And so I did discover that I have a huge gluten sensitivity. I didn't test positive for celiac, so I did all the functional medicine tests, whether it's saliva and stool and genetics and epigenetics, as well as hormone testing. Hormone testing revealed I had genes that predispose me to estrogen dominance.
Mhm.
And those were also playing a big role in some of what was going on with
Mhm.
my body. I also
Mhm.
discovered gut infections,
Mhm.
dysbiosis, and it was these things that really, and of course, nutritional deficiencies that I didn't realize. And it was really it wasn't one silver bullet. It was a number of things that were going on that I was able to identify and also learn so much. Education is such a big part of it, and
Mhm.
knowing about
Yeah.
the toxins in our environment and learning how to avoid them. For example, with women, especially who I work more with, about our everyday shampoos and soaps and makeup
Mhm.
and all the toxins we're exposed to, the toxins in our food, in our air. And yes, we did also have mold exposure in the previous house I was living in, being in the South, where there's humidity and heat, that mold's going to grow easily whenever there's a leak, whenever there's rains, which can happen
Yeah.
even in a brand new house. So I was dealing with all these problems, but now I had a way out. I knew
Mhm.
that there was hope. I knew about my body's power to heal without the use of drugs. And
Mhm.
yes, coming from a conventional background, I know there is a role to be played. Like if you have severe sepsis, you're in the hospital, yes,
Mhm.
you're going to need pretty big
Right.
gun antibiotics. And
Right.
if you have a hard blockage, that's probably late in the course of the illness where you need surgery or stents. But we're talking about everyday life and
Mhm.
chronic illness and quality of life. And that
Right.
really is something that I wish I had known before.
Yeah, right, right. Yeah. You do the best you can with what you know at the time, and then when you know more, you do better. And yeah, so interesting. And so you uncovered a lot,
Mhm.
which sounds overwhelming. You know what I mean? Like, I think for a lot of us who go through a similar journey, and I actually had a kind of a similar journey. It feels kind of overwhelming to go, oh my gosh,
Absolutely.
three gut infections plus parasites and autoimmunity and all this stuff. It's like, where do I even begin? So I guess I would ask, like, kind of how long did it take, and what did you do first, and how did you approach it?
So I really started with gut first because a lot of my
Hmm.
symptoms were also gut related. So
Yeah.
I did do an elimination diet, which I think
Hmm.
that itself made me feel so much better. I couldn't believe
Hmm.
it. I did do a full gut repair and did a gut and liver detox and started taking, based on the testing that I did, I started taking supplements, which again, I had taken vitamins before, but again, haphazardly, randomly.
Hmm.
This was very precision based and based on what my body was lacking. And so
Hmm.
I think the best thing that drove me forward from overwhelm was feeling better because I knew
Hmm.
it was
Hmm.
working. And yes,
Yeah.
sometimes I did have setbacks, but I always was hopeful that I was in the right track, and maybe I needed to change a few things, and but I was able to do that.
Hmm.
So I think that gut health was a foundation, and then based on the testing that I did on my saliva, my cortisol, my DHEA, and other hormone levels,
Hmm.
I started balancing them. In the past, before I had my babies, I did take birth control pills. And again, I
Hmm.
didn't even know about the possible side effects that they can cause long term. So I was so glad that I knew about them. I was educated, came off of some of the things, or even things like Tylenol and
Hmm.
Motrin that I considered in my previous years as okay. And so just eliminating those things, changing my environment, changing my foods to organic, changing my makeup and knowing the sources, reading the ingredients, even little
Mhm.
things like that, I felt made a huge difference to me,
Mhm.
but also to my kids and my family. And
Mhm.
um, and then I started working on stress management and
Mhm.
sleeping better, because sleep is something I'm very passionate about. Because even before I went through my C-section one night, I was on call where I had been up all night. I
Mhm.
was pregnant. I was driving home
Ooh.
and fell asleep on the wheel and almost veered off the highway when someone literally honked behind me and woke me up. Otherwise, I would have
Yeah.
crashed into the side.
Yeah. Oh.
So as a resident, sleep was always on the back burner. And of course,
Mhm.
I was much younger and I thought I could do it, but really focusing on prioritizing sleep, taking time to meditate and taking care of self-care, it
Mhm.
really made such a big difference. And it wasn't something I just heard being mentioned. I was actually practicing it.
Mhm.
And
Mhm.
I did initially, it was hard because I'm not the kind of person who can sit down and be still and meditate.
Yeah.
So
Yeah.
it took some time, but now when I don't do it, I can tell the difference. I miss it. And
Mhm.
um, and again, even with the weight and the exercise, I was so glad that I was able to do it in a healthy manner, not
Mhm.
by starving, not by counting calories, but by really eating healthy, moving well. And I can look back and now I feel so much stronger. I'm 51 now, and compared to when I was in my late 20s and early 30s, I feel so much better now. I have more lean muscle mass. And so that was really the more or less foundation, without going into the
Mhm.
weeds on how I did it, really
Mhm.
using the
Yeah.
gut and the liver as the foundation, the pillars as the
Mhm.
hormone, and then the mind body balance and stress management, and
Mhm.
kind of connecting it all together
Mhm.
with movement and
Mhm.
exercise.
Right, right. Yep, absolutely. Yeah. And that's fantastic to hear that you feel better now than you did 20 years ago,
Mhm.
which gives everyone hope that
Yes,
it's not going to just be a downhill slide as you get older.
of
We
course. Yes. And
should,
that's so
yeah,
empowering, right?
yeah, we should aspire to more than that, to feel even better as we go along, that we can continue to improve our health and feel better. So I wanted to dig into a couple of areas. The Hashimoto's specifically, so did that kind of was that addressed by all the other things that you did, or are you taking a Hashimoto's specific medication for that, or
Yeah. So initially, I wasn't even tested for Hashimoto's. When I first went to my doctors, they checked my thyroid. And actually, later, I was able to pull my labs and see that literally my thyroid was teetering on the brink of the cliff,
oh.
ready to fall off. But I was told it was normal. And so, really, after I got into functional medicine and I got the mentorship and got checked for it, it was then that I found that I had
Mhm.
Hashimoto's. But
Yeah.
actually, it must have been an early stage because my antibody levels were not like sky high, which learned was really that number in the antibodies is the number of cells that have been tagged by our immune system in our thyroid to be attacked. But I can happily say that my antibody levels are now normal, and I have
Mhm.
even helped others attain that. And the
Mhm.
way I did that is through a number of these things, really,
Mm-hmm.
which is, I felt the diet was the key, the gut
Mm-hmm.
health and treating the underlying triggers and causes was the key,
Mm-hmm.
supporting my immune system and getting rid
Mm-hmm.
of toxins. And part of that included removal of mercury fillings in
Oh.
my dental cavities, of which I had over the years.
Right, right. Yeah, which is an important thing people don't realize. Mercury is a
Mhm.
toxin and it's in many of our mouths. So,
Yes.
yeah. So, yeah, I'm glad you mentioned that. So, yeah. So, really, by addressing all of these more systemic areas, your Hashimoto's kind of came back into balance. And I think it's important to, something you said, that the thyroid testing that probably your OB/GYN was doing was not turning up Hashimoto's. You needed to look, more extensively, do more extensive testing, which I think a lot of folks don't, or women don't realize
Mhm.
they need to do. So,
Exactly. And it's so common. And I didn't
mhm,
realize how common or prevalent it was. And it's
mhm,
getting, I think the rates of all autoimmune conditions are going up exponentially. So unless we test for it, or even if we test for it, unless we know how to address it, but not by suppressing the immune system, but by really addressing those root causes, we're not going to be able to help people who are suffering with it. And
mhm,
the thing with autoimmunity is that you can still function. You may still be working a full-time job or taking care of kids at home, but you don't feel right. But others don't perceive that. They think that you may be even faking it.
mhm, mhm. Right, right. Yeah, absolutely. Which is so unfortunate.
Mhm.
Yeah, yeah. There's so many of us are like just kind of slogging through the day, and yeah, trying to make it look like everything's fine. So yeah. So, Dr. Farah, you talked quite a bit about diet. So, did you, in the food sensitivities aspect, so did you sort of customize a diet for yourself, or was there sort of a kind of a blueprint, like sort of paleo, but with modifications, or what did that look like?
Yes. Yes, I did. First of all, eliminate the more inflammatory foods for me. They were
Hmm.
definitely dairy, gluten, soy were the
Hmm.
biggies, but also I just got rid of artificial sweeteners and processed foods,
Hmm.
preservatives. I started
Hmm.
being more mindful about eating foods that hadn't been highly sprayed and were like organic meats. So yes, it was kind of a paleo diet, but paleo still allows a lot of fruits and honey, but I'm very sensitive to sugars. I don't feel too good, so I have to even eat those in moderation. So
Hmm.
it was, I would say, and I was not strictly autoimmune paleo because I feel I do better with more protein, but I do like my eggs, but I make sure they're pasture raised eggs. And I
Hmm.
knew they weren't a problem for me, but I still don't overdo them, and I don't do them
Hmm.
every day, but they're a good
Hmm.
option. And but really, and I love spicy foods, and so it would be hard to give up all the seeds. And
Right,
coming from India, we do eat a lot of spices, but I was
right.
able to modify a few things more for myself. So,
Mhm.
for example, I love cauliflower rice, and
Mhm,
but I
mhm,
make it all spicy. Or things like even lentils, I just would soak them well, cook them well. I love lentil soup,
mhm,
but I don't use that as my only protein source. But
mhm.
also I found that tofu, which I grew up considering healthy, wasn't for me because of the soy. and
Right.
uh, and but even the oils, changing the oils made a big difference, because we don't realize the oils that we
Mhm.
are kind of brainwashed into thinking are healthy are
Mhm.
actually doing a lot of damage to our cells at the
Right.
cellular level and can be so hard to get rid of. And even
Yeah.
sometimes when you try eating healthy, like say nuts or seeds, unless they are raw, like if they're roasted in those corn oils and soybean oils and canola
Mhm.
oils,
Mhm.
they're really getting
That's true.
incorporated into our cell membranes.
Mhm. Right, right, exactly. Yeah, yeah, and that's something that so many people are not aware of. It says vegetable oil on the
Mhm.
bottle, so that sounds good, right? So, yeah, but it can be really inflammatory. And it is in so many things. I was looking at mayonnaise on the shelf yesterday, and there's soybean oil in most mayonnaise, and then canola oil and the rest of them, and they're starting to be a little bit better with avocado oil or olive oil and
Mhm.
mayo as a but you really have to read everything.
Exactly. You have to be such a big advocate for yourself
Yeah.
and your family and your loved ones because even if it says natural and healthy and organic, it's those hidden messages, and you really got to read beyond them.
Yeah, right. Exactly. Exactly. Yeah. I learned that there is actually no industry regulation for the word natural. Anybody can put natural on a label. So that was eye opening because my 11-year-old, he'll show me something and he'll say, it's all natural. It says so. And I'm like, anybody can say that. So
Exactly.
trying to educate him as well now. But okay, so Dr. Farah, just a couple more questions here. In terms of hormone replacement, because that is such a big area
Mhm.
that you work in, what are some misconceptions or maybe and important things that people should know about that?
So first of all, to know that a lot of symptoms that women are experiencing are due to hormone imbalance. And you have to measure your hormone levels to
Mhm.
really know what's going on, because a lot of things can be attributed and treated as, oh, it's depression, oh, it's PMS. But again,
Mhm.
going back to the root causes, the
Mhm.
hormones themselves, though, are affected by lifestyle, by foods, by stress, by inflammation, even trauma, all of those things. Also, taking synthetic hormones is one of the worst things you can do. And to know and be aware of the side effects from in the younger years from birth control pills, and in the latter postmenopausal years from synthetic hormones. But
Mhm.
again, a misconception is that taking hormones is dangerous, or hormones don't work, or are they going to be effective? And many people are either afraid of bioidentical hormones, or are not aware of how to take them or who to see. So I would just say that, or encourage people, first of all, that there are numerous studies to show that they are safe, they are effective, they work. You should get them tested. See a functional medicine practitioner who is well versed in hormone balancing. And yes,
Mhm.
you can't take hormones by themselves and do nothing about your lifestyle, or do nothing about looking at your other hormones. So, for example,
Mhm.
your thyroid, your insulin, your cortisol, your DHEA, and your other adrenal hormones, or your leptin and ghrelin, which are your hunger and satiety hormones. Really, our body is so interconnected, and we've got to
Mhm.
connect those dots together and look at you as a whole person. We can't be treating anyone by separating organ and body parts, which is
Mhm.
what conventional medicine does. And
Yeah.
so I think just kind of disrupting some of those myths can help women feel and live such better lives.
Mhm. Yeah, absolutely. Yeah. Thank you for that. That was a super helpful explanation. And then sleep. Let's talk, yeah, a little bit about sleep. What are your top tips for optimizing sleep, maybe some things that aren't, because like there are a lot of articles out there today about sleep. What are some of the maybe not so common or obvious things that people should look at?
So definitely there's a huge connection between sleep and hormones. And
Hmm.
if your hormones are off, then most likely you may have difficulty either falling asleep or staying asleep or waking
Hmm.
rested even after adequate number of hours of sleep. And the
Yeah.
quality of sleep does matter because um, our creativity, our cognition, our metabolism are all,
Hmm.
even our ability to detoxify is all related to good sleep. And that's one of the things that's easy because we're busy, we're stressed, to put on the back burner. So um, so other than hormones, I'm excited about even things like peptides that can really
Hmm.
also make a big difference when it comes to sleep, and really help with longevity and anti-aging. And of course, I love biohacking. And so whether it's any gadgets that can help with sleep or just mindfulness, they can really be a game changer to just help you sleep better without the use of addicting medications.
Hmm. Right. Absolutely. Yeah. What's your favorite gadget for sleep?
I love the chili pad because I'm going
Oh,
through menopause, but
yeah.
there's many. I mean, I love meditation and
Hmm.
just guided meditation. So I use apps like I love Insight Timer and
Hmm.
Headspace. So I mean, there's so
Hmm.
many others, but those are a few. And I love my blue blockers, I would
Hmm.
say. And then your mitochondria, because if you want to lose weight and have more energy, then you actually make 90% of your melatonin in your mitochondria and 10% in your pineal gland. So really energy, sleep, and mood and metabolism are all interconnected.
Right, right. Yeah, so interesting. Yeah. Well, Dr. Farah, thank you so much. This has been super interesting to hear your journey. And now, tell us a little bit about who you work with, who you help, and where people can find and follow you.
I love to help women going through the change of life in perimenopause and menopause to balance their hormones and sleep better. I'm
Mhm.
on Instagram at Farah Sultan MD, and
Mhm.
my website is vitalogywellness.com. That's VITALOGY. And I'm going to be offering some freebies that I'm going to give to Casey to put in the show notes.
Yeah, awesome. Yeah, thank you so much. Definitely follow Dr. Farah to get some tips. So yeah, I was looking at your Instagram and super helpful stuff that you're sharing. So I know folks will get a lot out of our conversation today, as well as some of the other things that you have to offer. So thank you so much for coming on and sharing time with us and your wisdom.
Thank you so much for having me. It was a pleasure.
Yeah, absolutely. Bye.